there, I'm Lisa Fisher, host of the podcast here for Arkansas Heart Hospital. I'm a longtime broadcast professional. I like to say professional, seasoned broadcaster here in Central Arkansas, and I'm here to learn, and that's why I'm so excited about these podcasts. I'm here with Michelle Rupp, who's done a few radio, TV gigs in her day as well.
Just a few. Yes, I'm Director of PR and Communications here at Arkansas Heart Hospital. We are so excited that you are joining us on these podcasts from the heart. We hope to give you a little nugget of information, maybe make you just a smidge smarter as you are traveling the roads of Arkansas or wherever you may be in listening to this podcast. Everything, of course, it's Arkansas Heart. We are centered around your heart. You know, you only have one heart. You can live without one of your arms. You could live without one of your legs. Mm-hmm. You could live without one of your kidneys, but you can't live without your heart. And so everything centers around the heart. And today we are talking about some osteoporosis. And you might not think about that when you think in terms of heart, but if your structure is breaking down, I would think internally you might be breaking down as well. And so we've brought in Eric Martin. Eric, how you doing today?
I'm doing well, thanks.
Great. Go ahead and give us your credentials. Let everybody know what you do here at the Heart.
Well, I'm the Director of Wellness and Prehabilitation here at the Heart Hospital.
And prehabilitation is a new term to me, and that's getting someone before they come in for the procedure.
That's correct.
Rehab is after.
Correct.
Okay. So, and part of that, learning about osteoporosis, of course, with women part of the show, you definitely know that that's something physicians always ask us about. The lighter-eyed woman here to my left, you know, I know that concerns them. For me, you know, as we age, women go through menopause, but our bone health is a real indicator of a lot of things with our health. Tell us a little bit about osteoporosis.
Well, osteoporosis is basically an increased loss of bone mass, and right now, it costs about $19 billion a year for health care, and they're predicting that it's going to go up to $25 billion by the year 2025. So it is something that we definitely need to take on as a society to help all of our citizens around the U.S. Get better. So one of the interesting things about osteoporosis and one of the difficulties with it is it's generally asymptomatic. So a lot of times it goes undetected until a fracture can occur. Mm. And so we basically need to go into a preventative mode.
Mm-hmm. And as a woman ages, though, with the loss of her female hormones, then she has a risk of increase, right, of osteoporosis.
That's correct. Basically, after a woman goes through menopause, there is an accelerated bone mineral density loss in a 3 to 5 year period. And so what happens with women while they're at higher risk is, one, they generally don't have the same amount of bone mass as a man does, and then they go through menopause and they have that 3 to 5 year span, and so that puts them at a higher risk.
So what can you do for someone who is maybe a female who might be in her 30s or maybe early 40s who is not at menopause age, who is not even in that bracket, but might want to catch something before you get too far down the osteoporosis road?
Well, one of the main focuses, and especially coming from the exercise science side of things, is basically in the prevention mode, we're looking at exercise and nutrition. So exercise is going to help keep our bones very strong. It's very important to have a healthy habit of daily exercise. And then the nutrition side, where we need to be getting enough calcium, enough vitamin D so that our bodies absorb the calcium the way we need it to. So those are two of the primary things that we would look at. And
if you're talking to someone who predominantly likes to do cardio, while that is great, you also want to add in strength training, maybe.
Oh, most definitely. So basically the strength training puts different stresses on the bone, and if we're working with an individual, we want to look at putting that mechanical stress on a bone from maybe different angles than they're used to in order to help it be stronger. But resistance training, weight-bearing activities are very, very important for keeping our bones strong.
Any kind of testing that can be done?
Well, we can. There is what we call a DEXA. It's a dual energy X-ray. Basically, it's a ramped up X-ray, and they're able to look at the.
Is that the scan?
That's the scan.
Right.
All you got to do is lay down, and
Right.
they run a scanner over you. It's very very easy, not threatening whatsoever.
Well, the reason I referenced her light eyes earlier, as a thyroid patient, I'm always at a higher risk because the higher the thyroid dose, the more it could contribute to osteoporosis. And when I had my DEXA scan, I remember my doctor, the first thing he asked me was about my DNA. Where are your people from? And I went, really? And he said, yeah. And he goes, the Caucasian women and Asian women have higher risk of osteoporosis, but my grandparents are from Russia and the Republic of Georgia. Dark hair, dark eyes. And he goes, I bet when we do the DEXA scan, he goes, you won't have what maybe your peers have at the same age. And he was right. So that's why I kind of referenced earlier Michelle with her lighter eyes. But that was something he said is a big indicator. And especially he said, if you were a thyroid patient with light eyes, I would back down your thyroid dose. And I went, wow, these bones, they were dim bones. They really matter. And I guess a woman, we're not, because you said it's not symptomatic. There's no symptoms until there is that break. So before you get to that, I mean, should we just walk around the house with soup cans? A
soup can in one hand and a glass of milk in the other.
Right, I know.
I feel like I need,
Well, we just go, and I always go back to the American College of Sports Medicine, their recommendations for an exercise program, and one is to have a regular exercise program. And again, it goes back to we're doing cardiovascular exercise. They need to be weight-bearing exercises. So, and really it depends on the individual that comes in, because we're going to have individuals who can't do the weight-bearing, and they need to go to like a swimming pool in order to get their activities.
So you could still get the same, because of the resistance, some of the same benefits?
Yes. They're not going to be as good as the weight-bearing exercises, like going for a walk. But some exercise is better than none, basically.
Sure.
Yeah.
If you find yourself at that point where you've had a fracture, what questions should we as women maybe be asking? Do we need to ask, well, what are our vitamin D levels? Or
low?
But yeah.
I'll tell you that.
Or should we, as the patient, ask for, can we do a DEXA scan? Can we, what kind of information might we need to know, rather than just relying on the physician to say,
this is it.
This is it.
That's
Yeah.
what you got.
Or you need to stop off and get a 2-gallon jug of 2% and chug it on your way home.
Well, you've already brought up the good questions that you need to be asking, and we need to be talking about our calcium levels. There's plenty of medications they can prescribe out there. I'm a fan of basically doing it through dietary means, because there are increased risk of cardiovascular disease with increased calcium supplements.
Oh, really?
So
that's interesting.
And basically, research doesn't show that increased risk when you do it through dietary methods. So basically, going to your dark green leafy vegetables, the dairy, and of course, you have to be careful with the high fat of the dairy. You've got calcium fortified orange juices and cereals and things like that you can go to. But in some situations, individuals, they're just going to need that medicinal
Does
support.
the calcium need to go hand in hand with the vitamin D or magnesium? Is there some combination that I've read about?
Yeah, it's the vitamin D. And
Okay.
so that would be another question to ask, what are my vitamin D levels? Because the vitamin D is going to help the body take up the calcium the way it needs to for the bone support.
Well, I think my doctor told me that anyone north of like the equator, he said, has low vitamin D, because we're not in a generation that is outside. We run inside as quickly as we can, or we have so much sunscreen on. She said it may block you from really getting the vitamin D you need.
Yeah, not a lot are out riding their bikes until the streetlights come on anymore, or the fireflies come out anymore.
Yeah, and the sunscreens are great, but we do need to spend a little bit of time outside in the sun without any anything to block
but
it.
That's
of course, we don't want
counterintuitive what we've been told.
Most
because
definitely.
we really do need it. God put it up there for a reason.
He
wasn't making it up.
He most certainly did, and he knew what he was doing when he put it there.
Yeah.
So we just have to, learn our limits and know about when we're going to start to feel that sunburn, and then we can apply the sunscreen.
For the older population who might be listening, what do you recommend? What do you say to those women?
Well, I would say get on a planned exercise program, and if you're not sure of how to do that, we're here at the Heart Hospital. We're more than happy to help any individuals that need that assistance. frailty is one of the things that we're looking at with cardiac prehabilitation. And so a lot of those individuals that come in who are considered frail are going to have some osteopenia. And
is that the precursor then to osteoporosis?
It is. It's basically the low bone mineral density, but we're not quite to the point where we can call it osteoporosis. And we'll have some with osteoporosis. So there are some things, that we have to be careful of. If somebody does have osteoporosis, we don't want to do any flexion exercises with the back because, those individuals, the highest risk are basically for fractures in your wrist and your hips and your lower back. And so there is some direction that needs to be done in order to help these individuals exercise safely.
Well, as a woman walks that path into menopause, she's often recommended to start HRT, hormone replacement therapy. Does that help prevent the estrogen replacement? Will that help prevent the bone loss?
Yes, it is set up to help prevent the bone loss.
Okay, so that's really important.
Yes, it is. So I wouldn't consider myself an expert in the
right,
estrogen replacement therapy, but yes, that's the mindset behind it is, when you go through menopause, you're losing that estrogen, and that's one of the reasons the osteopenia, osteoporosis comes on. And so if we can replace that estrogen, then it helps keep the bone strong. Okay,
let's not neglect the men then.
Okay.
For the woman listening, she's sitting there nudging her husband, going, well, you got to get checked too. Tell him why.
Well, men are also susceptible to osteoporosis. And basically, when you look at men and women, the dietary needs, they look at changing them around. We basically recommend about 1,000 milligrams per day of calcium. And so around 50 years old for women, they up that to about 1,200, and men are a little bit behind them. Around 70 years of age, they're looking at increasing that also. But men do need to be aware of it, and we know from research also that if a man who has osteoporosis falls and breaks his hip, he's twice as likely to pass away from that as a woman is.
Wow.
So men also need to basically go into a prevention mode. We can as testosterone levels decrease and estrogen, for men also it can cause that bone loss.
I've never understood the connection or the correlation between a broken hip and death. Well, what is that?
That's a very, very good question, and I think that's something that's still being looked at. I know one part of it is that an individual, of course, when they break their hip, it's very traumatic, and it gets you down for a very extended period of time, and it's very hard to get back. So, with all the advances we have, some individuals it just breaks them down, and they're not able to come back from it.
Wow.
And you think about your physical health does so much for your mental health, and so for anyone who's down in a bed, but a man who's been active all of his life, I'm sure that would be quite a reversal in the role he had planned for himself.
Most definitely. And I think that's an interesting point you bring up, because as the director of wellness here, we talk about wellness concepts, and the physical aspect is what we always focus on. But we have the spiritual and the emotional and the intellectual and the social also. And so they all feed off of each other. And when one breaks down, the others start to fail also. As they fail, then a person can really get down.
Can the hospital provide then assessments for somebody who's just wondering where I am? I mean, can they just come in off the street?
No, we don't have a DEXA machine here. I think it would be with any of the physicians here. They can ask those questions about osteoporosis, and I know our physicians are very knowledgeable, and they can get them to where they need to go. Again, we're happy to help in any way we can. Being asymptomatic, again, it's hard to detect, but as we look at older individuals, if they're having a lot of lower back pain, loss of height, stoop posture, if a bone basically fractures more easily than it should, then those are all signs of osteoporosis.
One quick and probably final question: is this hereditary at all?
It can be, yes.
Okay.
One of the risk factors they look at is if a family member, a first-degree family member, has had
a mom or a grandma,
has had a fracture, then yes, you're considered a higher risk.
Okay.
Eric Martin, thank you so much for being with us.
Thank you.